Hello and welcome to the Beyond 6 Seconds podcast. I'm your host, Carolyn Keel, and I'm here with my guest today, Kate Wallinga. Kate, do you want to tell us a little bit about yourself?
Sure. So Carolyn and I met because we were both podcasters. It's a very tightly knit community, and you end up meeting everybody eventually anyway. I think that's the rule. I'm a forensic psychologist and crisis clinician by training. So everybody gets all excited because they think forensic psychology sounds really cool, but what it means is spending a lot of time waiting. You do a lot of time waiting to testify in court, or for your clients to show up, or you're waiting for the printer to unjam itself because your report hasn't printed, or whatever the case may be. But so what forensic psychology means is that someone is already in the system. I'm not a profiler, and I never have been. And I'm asked a question. Maybe, what's this person's diagnosis? Maybe, are they competent to stand trial? Maybe, what's the best way to house them after their court trial is all done? You know, do they need to be in Supermax? Do they need to be in a mental health facility? That kind of thing. I'm asked a question, and then I tailor a mix of tests and interviews to that. I did that for a while, and then for several more years after that, I switched to doing crisis work in the emergency room in private homes because my husband is an educator, and so his hours are very limited. Mm-hmm. And court hours are the same hours pretty much. So as we started having kids, I learned very quickly that kids ruin everything. And so it was very difficult to, I felt like I never saw my family, I never saw my kids. And so I moved to crisis assessment, which is whenever someone shows up in the emergency room or in their home, and when they're suicidal, homicidal, having a psychotic break, a manic episode, that kind of thing. And I show up and figure out, what do we do next? Mm-hmm. What's going on right now, and what do we do next? And the beauty of that is that, I guess beauty is a strong word, but people have crises 24/7. Mm-hmm. So I could work nights and weekends, and my husband could work daytimes. And I got to see everybody at every point in the system. And I still ended up going back and working in jails and prisons at times, doing that work because people have crisis in jail and in prison as well. And so I did that until 2014, and I broke my back. Not a great idea. And then I spent 4 years pretty much sitting home and moping. That was basically my full-time job, unpaid, was to sit at home and feel sorry for myself. And on New Year's Day of 2018, I went up to my husband, and depending on who's telling the story, I either gently tapped him on the shoulder, or I grabbed him by the shirt collar and pulled him in real close. And he said, "I'm going to start a podcast." And he said, "Okay." "Why?" And I said, "Because you all are making too much noise. Oh. Everybody keeps talking to me. And if I start a podcast, you'll leave me alone once in a while." And so that's where we're at. That was about 5 years ago now. And it seems to be going pretty well. So now I consider myself a podcaster where I work full-time for part-time pay.
Wow. You've had this incredible experience in these very intense and what sounds like very stressful environments, or very like high focus environments where you're dealing with people in some ways at some of the worst points in their lives, or the most highly critical points in their lives. Is that something that you bring to your podcast now, like all those experiences, or are they related to what you talk about now on the show?
I hope so. I hope I bring them. My show started as a true crime adjacent sort of show, mm-hmm. because I would hear people misuse terms or make assumptions, or just, I don't understand how somebody could do something like that. I could never murder somebody. And I'm like, you know what? I guarantee you could. Or I would never confess to something I didn't do. And I'm like, you know what? Give me 3 hours. Okay, 23. But give me enough time and I could make you forget your own mother's name. Mm-hmm. You know, it's our brains are mushy and they act funny under stress. And being interrogated is one of the most stressful things that a human being can go through. And so it started with me just feeling like, well, I'll do 5 or 10 episodes. I'll describe what forensic psychology is, what it's not, what profiling is, and what it's not. And just try to get people to understand a little bit, like, you're a lot closer to violence and murder than you realize.
Mm.
And that's sort of, I don't know whether the idea came first or the title came first, but the title of my show is Ignorance Was Bliss. And sort of one of the taglines is, didn't you feel better before you knew that?
Mm.
Because I felt like, if I can just get you to understand a little bit more how somebody ends up doing this, you might not sleep as well at night, but maybe you'll be a little less flippant about calling the bad guy bad names or whatever it is that the true crime podcast community likes to do nowadays. So that's how it started. And then, like a year or so in, I experienced a tremendous personal loss in my life. And so I had to step away from podcasting altogether for a little while. And then when I came back, I was like, I don't want to just talk about dark stuff. Like, sometimes that's fine. That's life. No problem. But I want to talk to other people too. I want to talk to gamers, and I want to talk to actors, and I want to talk to authors, and I want to talk to Carolyn, and I want to do all this stuff. And so I decided, what, this is the beauty of podcasting, is there are no rules. So I still do maybe 20% of my episodes has something to do with crime specifically, but all of them have something to do with psychology, with people's stories. I consider myself a story collector.
Mhm. Yeah, story is something that has always excited me in general, and it's really what got me into podcasting, is just really trying to tell the stories of people that those stories that I wasn't hearing anywhere else, really. I knew they were like really compelling and fascinating and inspiring and motivating and all of those things, but they weren't out there for whatever reason. Just, not everybody's out there sharing their story all the time. And even if it's amazing and the work that they're doing is incredible. So yeah, totally relate to that story being an important thing to share as well. Absolutely. So, as my listeners know, this is a podcast mainly focusing on neurodiversity, disability, and you mentioned in your just a little while ago some of the major challenges that you had went through in the past couple of years. But you're also neurodivergent in many different ways. Would love to learn a little bit about how that journey took place. I know it's kind of like a series of events. It wasn't like all at once. So I'm just kind of curious about how that came to be.
Kind of was, though. Honestly, kind
Yeah?
of was. More like falling off a cliff. For
Oh.
me, I was not neurodivergent as a child. I was not neurodivergent through my 20s. I, in fact, ran a clinic for a while that diagnosed learning disabilities and ADHD.
Mhm.
That was my job, and I supervised it. That was my in I can remember when making lists made sense to me, and I can remember not ever wondering, what is wrong with my brain? Like, I can remember what it's like. My moods would be off, but my thoughts would be clear. And then in 2010, I effectively died in childbirth.
Wow.
I had a near-death experience. I spent 10 days in a coma
Ooh.
and six weeks in the hospital. It was a mess. And when I came out of the coma, I had complete amnesia for the full year leading up to the birth. Like, I didn't remember giving birth. I didn't remember being pregnant. I didn't remember going to Paris. I didn't remember, like, all this stuff. I didn't remember words. I couldn't speak at all. I didn't know my own name. And let me tell you, that's terrifying when that happens, because that's one of those things that people ask you and they're like, "Oh, what's your name?" And it's just tip of the tongue. You just know it right away. And it's so hard coded socially that people would ask me, "What's your name?" And I would start, I would try, because some part of my brain knew I was supposed to know it, but I couldn't find it. I had completely lost my ability to handwrite. So my handwriting is totally different than it was before. Nothing really neurological happened during the coma. It's just that the brain really doesn't like to sleep for a week straight, no matter how much we say we would like that. And so for the next couple of years, I kind of masked and faked it and struggled a little bit. And then so that was 2010. I went back to work in 2012 for a couple of years. And then in 2015, I had my first grand mal seizure. No warning. I had no idea it was coming. I had no idea it was happening. And again, you come out of the seizure. A grand mal seizure is a hard reboot of your brain. So the systems come up a little at a time. The eyes open before the brain turns on. And I have a very, very clear memory of the EMTs asking me what my name was and going, "Oh, and it just wasn't there again." And this time I had another EEG. I'd had one in 2010 and everything was fine. I had another EEG in 2015 or 2016, and now there's a significant lesion in my right frontal lobe. Which is where a lot of executive functioning sits. So ADHD, autism, OCD, schizophrenia actually sits there as well. The ability to come up with a plan, follow the plan through, and then assess how well the plan went. So a lot of cognitive stuff sits right there. And that's exactly where this lesion is. And nobody really knows how I did that. Like, I didn't have a fall or anything. It's probably the result of the seizure, not the cause of the seizure. And so I just lived with it for a while. And again, like a lot of us, either because of social pressure or personal pressure, we that's really what masking is, right? Is pretending to be normal, pretending to be ourselves, whatever normal is for ourselves. And as time went on, my memory was getting worse and worse and worse. And my ability to do things like rely on lists, I couldn't write a list anymore. And it wasn't a physical thing. It was neurotypical people, if they write a list, they can write like, here are the things I'm going to do on Tuesday. And they can do that. And they can assess, here's about how many things I typically do on a Tuesday, and I can write those things down, and we're good. The first item I write on a to-do list is write to-do list. And then I just keep writing. I can't, I'm writing down to the smallest thing, like remember to stop and use the bathroom, like things that I'm going to do anyway. And I'm writing huge projects that there's no way I'm going to do on Tuesday. I just don't know when. The concept of list writing wasn't working for me anymore. And around the same time, a relative of mine had been diagnosed with Parkinson's, and I started to think, oh no, I have early onset dementia. That's what I believed. And I was 36 at the time. And I was like, I'm going to die. That's what's going to happen. I'm going to forget everything and die. And I already had a neurologist because of the epilepsy. And so I called and I was like, in this full panic, I need to get assessed for something, or get on meds or something. I don't even know, like whatever. And he's like, well, let's start with having you see a neuropsychologist and getting an accurate assessment. And it was a little bit snotty with him about, well, I used to run a clinic like that. I know what the tests are. I know what the answers are. He's like, that's okay. Come in anyway. And because it's true that I did remember some of the answers, but it's not just knowing the answers. There's how long does it take you to come up with the answer? How do you word the answer? How do you approach the test? And there were other answers that I just didn't know at all. And when I was done with it, he says, well, I'm going to write you up a report. And that takes somewhere between, 2 weeks and the rest of your life, it feels like in the moment. But I can tell you right now what your diagnosis is if you'd like. I said, sure, that'd be that'd be handy.
Mhm.
Thinking, I was there alone, and I'm inside. I'm like, oh God, I thought I would have my husband here with me to hear this terrible news that we would go through together. Whatever, this is awful. And he says, no, you have ADHD. I say, no, I don't. Like, what are you talking about? Of course I don't. I know what ADHD is. 2 of my kids have it. I don't have it. What are you talking about? Like, I used to diagnose people with it. And he's like, okay, like, I'm going to do the scoring, and I'll do the write-up, and we'll meet again, but I'm telling you. And I live about 20 minutes away from the testing site. And by the time I got home, I went from, no, I don't, to, holy crap, I have ADHD.
Wow.
Because I could picture the page in the DSM, the Diagnostic and Statistical Manual, that has all of the diagnostic criteria for things. And you don't have to have all of them to be diagnosed. You have to have a certain number of them. And I had more than enough. And I was like, wow, that's what it is. That's, I think differently. And so it's this lesion in my right frontal lobe has just literally cognitively changed who I am, which has changed my emotions and has changed my personality in certain ways as well. But first of all, knowing that it wasn't Parkinson's was reassuring.
Mm-hmm.
And secondly, just knowing what it's not helps, but knowing what it is helped, because it gave me a better sense of who I am and things I can try. Now, one thing I can't try, and this is a fabulous little bit of cosmic irony, and by fabulous, I mean terrible, is that I can't take ADHD medications because most of them are stimulants, and they are prone to causing seizures. And they believe that having a seizure is what caused my ADHD in the first place.
Wow.
Right? So it's this cyclical thing. I'm like, that's not fair. But fine. By that point, I was already on disability. So if I'm having a day where I just can't focus, or I just can't think in a functional way, it's okay. I can usually put it off by a day, or I can ask my husband for help or whatever. And I've learned a lot of coping techniques and ways to compensate instead.
Wow. So in terms of the podcasting, did you start your podcast after getting the ADHD diagnosis or before?
Yeah, I started the podcast a year or 2 after, kind of with this mindset of, I don't know what I'm doing with anything.
Mm-hmm.
Really. I'm learning all kinds of things from scratch. So let's start this hobby from scratch. I don't know how to edit. I don't know how to, nobody's born knowing how to edit. Nobody's born knowing how to record things. Let's learn. And if I can't learn, okay, I'll find a different hobby. And I'm 5 years in, so I seem to have figured it out.
Yeah. I know when I do podcasts, I have like whole systems. They're not necessarily checklists, but I know I have like Excel spreadsheets that help me keep track of like which episode is in what state or anything that seem to help me and my autistic brain kind of keep everything all set and managed. So do you have certain tools that you've developed for your podcast that help you with the recording and the whole overall production end to end of your show?
Another fun fact about me is that I am mostly deaf.
Mm-hmm.
That's been most of my life. I was diagnosed with a degree of hearing loss around age 5, and it's gotten worse and worse and worse. And so I hear about 25% of what normal people do now. And so, again, people sort of assume that, first of all, I've had people tell me I don't look deaf, which is weird, and that there can't be deaf podcasters. I can't listen to podcasts. I just listen real loud. Like you wouldn't like, other people wouldn't like it. It's too loud for them. I have to use special headphones. But yeah, I can do that. And I edit visually.
Oh.
So no one ever taught me how to edit, and I've never given enough thought. Or maybe I'm not adventurous enough to create like a training for how to edit visually, but everybody who's in podcasting knows what a waveform looks like. If you've done it enough, you know what your ums look like.
Yes.
You know what looks like, things like that. And so you know what silence looks like, and you know what, normal ranges of sound look like, and you know how to make different speakers match, make their way for it. And so I just sort of figured it out. And so my early audio from, February 2018 is terrible. It's okay. Like, I accept this. What are you going to do? You had a deaf podcaster. I'm a lot better with it now. And so it was things like that I had to sort of self-teach. I have spreadsheets, but I more have learned to embrace chaos in a way that I used to, when I ran any of it, when I, working as a forensic psychologist, you have to be super organized and controlled at all times. When I ran the learning disabilities clinic, you had to have spreadsheets on spreadsheets on spreadsheets, and everything had to be just so. And it's just not a way I function anymore. And I've learned that that's really common with ADHD. And it has to do, at least partly, with the fact that we have a difficult time remembering something exists if we don't see it.
Mm-hmm.
But I don't, my husband, bless him, is he's a mathematician. He's deeply organized and likely autistic. Like, if we talked about how if we all have to pick our neurodivergencies, that's his. And his side of the bedroom is very neatly stacked and organized. And okay, I'm not making this up. This is the funniest thing. He's going to kill me for saying this on mic, but it's been a good run. We've been married 22 years. It's fine. He has 3 medications that he takes. And he codes them in a binary system, like zeros and ones, so for the day of the week. So like 1 is vertical and the other 2 are upside down, and he can look at that and say, okay, that's Tuesday. That's how I know I checked.
Wow.
Right?
Very impressive.
He's very, we met in engineering school, so this makes sense. And for me, it looks like clutter. Mm-hmm. It is clutter by typical standards, I think, but it's not mess. I don't leave spills, things like that. I have children. I make them clean that up. Mm-hmm. What I prefer to think of it is that my husband is a vertical organizer. He likes things stacked up. So when he has stacks of paper, you only see the white sides of the paper. And I'm like, how do you know what's where?
Yeah.
How do you know what that is? For me, I'm a horizontal organizer. If it's all spread out, it all goes in its place. If it's out of place, I notice immediately. Mm-hmm. If something's been moved or it's in the wrong place, I know right away. And so with the podcast, I've learned exactly where the pens go, and exactly where the chapstick is, and exactly where the marshmallows are, and exactly where everything goes certain places. Mm-hmm. And those are things that I've learned how to do to sort of compensate and function better.
Wow. Yeah, it's as you were saying, it might look like, to an outside person as a mess, but you probably know exactly where everything is because everything has its place. Mm-hmm. So you can find what you need. Yeah. So I just want to go back because I'm fascinated. As you were telling your story before, you mentioned, waking up from the coma and having essentially like aphasia, it sounds like, where you just, mm-hmm. You've lost a lot of words, amnesia, having to learn how to handwrite. But then you were able to go back to work 2 years later. Were you in intensive therapies to get these skills back? How did that come about?
Some of it came back on its own. So I had complete aphasia for maybe 2 or 3 days, mm-hmm. where I just couldn't answer any questions. I could recognize the language, but so it emotionally bothers me, but I can't throw it out either. So when you send a toddler to preschool, they do like an all about me poster.
Yeah.
Here's my name, here's my favorite color, here's where I live, here's my music, whatever. Well, patients that are in a coma or in the ICU, often the hospital social workers will have the family fill that out for the patient.
Mm.
And the reason for it is both to give the family a sense that they're doing something because you're so helpless so much of the time. And it also is a reminder to the doctors and nurses that this is not just a lump in the bed. This is a human being with preferences and with a life that brought them here. And so, don't just give their vitals, introduce them as a human being. And so somewhere upstairs in my house is that poster. It's all about me, for me. And it's, my name and my favorite music and my favorite color and address and things like, my children's names and that sort of thing. And so it's complicated. So what happened was during the childbirth, somebody in the delivery room had strep throat, and that got in my bloodstream and my uterus ruptured. And this is my third baby. And so I was like, something's super wrong. And their answer was, childbirth hurts everybody, drink more ginger ale. It's just gas pain. So I spent 3 days with no treatment at all, like not even a doctor. A doctor came in, tapped on my stomach 6 times and said, maybe you tore a ligament and left. And I'm like, what ligament are we talking about in my abdomen? And so by the time I actually they discharged me and I went directly to the emergency room. And by the time I got a CT scan, I had necrotizing fasciitis, which is the flesh-eating bacteria you read about in the tabloids. And so I had 13 surgeries that week when I was in the coma. So when I came out of the coma, I tell that story to explain that when I came out, I had an 18-inch incision from sternum to pelvis, and then I had a hole the size of a grapefruit all the way through my abdominal wall on the right side. I didn't know human beings could do that. Like, I was literally afraid I was going to sneeze and my liver would fall out. Like, this was a whole new world for me. And so I would lie on my left side because that was the only part of my body that was not completely messed up. And the poster was on the wall there. And so I was in a lot of pain and I was very confused. And I mean, they're telling me I just had another baby. Like, I didn't even remember seeing him or meeting him, or like all of this was the stuff of nightmares. And so I didn't sleep. Plus I had just slept for 10 days. So I laid on my left side and I read this poster over and over and over and memorized it. And that's how I started to learn my name. And I started to learn, okay, apparently I like the color purple. And the band that I had been listening for, this is 2010. And so at the time it was still iPods separate from phones, and the band I had been listening to quite often at the time was Blue October, which is a alt rock band out of Texas. And when my vitals would get out of control, my husband would put one earbud in my ear and one in his and play the music, and my heart rate would go down and my blood pressure would go down a little bit. And so that was on there as my favorite band. And we've always joked a little bit about, because we've got a little bit of a twisted sense of humor in my family, about how, what if he had made it up? What if he had put the color yellow, and I don't know, Garth Brooks or something, totally wrong answers only kind of thing. Would that be my favorite band now? I've always wondered. But that's, in any case, how I started learning things about myself. And then another thing that happens to a lot of people with traumatic brain injury is there's a look that the people who've known you for a long time before you had it, and then they meet you after, there's a look they give you when you give the wrong answer or you answer in the wrong way. So if I got frustrated quicker than I was supposed to, because I tend to be a pretty patient person. But that first year, I was not. I would get very angry and frustrated very quickly. And I was also very tired all the time. And it makes sense now that, my body was just trying so hard to fix itself. But I would get frustrated, or I would speak in ways that weren't typical for me. And somebody in the room would give me that look. And I would start to get the feedback of like, okay, I'm responding wrong. And
Oh,
it took me years to realize, no, they just expect me to return to my prior baseline.
mhm.
And that'd be cool and all if I could,
Yeah.
but this is who I am now.
Mhm.
And this is what my baseline is now. And if I give myself a little more grace and a little more space like I feel emotions differently. I have synesthesia, which I did not prior.
Wow.
And so if I accept that some songs smell wrong, I just accept that. That's just how it's going to be that day. And I can't say that to everybody. Like there are family members that I just can't have any contact with anymore because they're so intense about, you're going to get better. You're going to get better. And I'm like, what if this is it? But what if I don't?
Mhm.
What if this is as better as I ever get? Is that good enough or not?
Mhm.
And so it was a lot more eventually talking therapy once I had enough words to get through it. It was a lot of working with my husband. I mean, one of the first complete sentences I was able to say to my husband when I was still in the ICU
Mhm.
was, "We need therapy." And at that time, we weren't having marital problems. There was nothing going on. It was just that I don't know what just happened. We both our lives just got steamrolled.
Yeah.
Something big happened. At that point, we'd been married 10 years. We need to figure out how we're going to work through this together because it's a huge, major change, even without the ADHD, even without neurodiversity. Just the simple recovering from a medical trauma is a lot. But then when you add the ADHD on top of it
Mhm.
and realize like, I don't know how to be the person that you married. And so either we need to go to therapy or we need a divorce because I can't be that.
Mhm.
And we're still married. So
Yeah. So you talk about people giving you the look that at that point would give you the feedback that like, oh, okay, I'm not responding in the expected way. Did that feedback contribute to you like masking maybe in the early days or any point and trying to act like you used to?
I mean, I'm sure early on, my mother, with whom I have no contact anymore, because she's never going to forgive me for getting sick
Mm.
and for being broken. And I don't find any shame in being broken. I think that breaking is part of life. But my mother is very much about, don't have problems, just don't have problems. I'm like, okay, well, I can't help you there. So she was one of the more vocal early on. Like she would shame me in front of other people,
Oh.
or she would make unilateral decisions. I mean, like, and now I want to like credit where credit's due. When I was first recovering, so I was in the hospital for 6 weeks, and then for about a month after that, my mother lived with us. So she lived with us lived with my husband and my kids the whole time I was in the hospital, and then for like a month afterward, until the end of my husband's semester.
Mhm.
And then she went home. So I am grateful and acknowledge the effort that she put forth in, closing up our house and moving in and taking care of my children, because I couldn't leave the house for a year. I was on home health care because of these open surgical wounds that were still healing. So my son was born in March, and that Christmas, so 9 months later, we were trying to play a card game, and it was a card game that we'd played 1,000 times. So I was told. I didn't remember it, and I couldn't learn the rules. And it's a form of rummy, but it's played with 2 decks, even if it's only 3 or 4 people. So it's like, it's a lot of cards, and I didn't have the, it took me a long time to redevelop, fine motor skills as well.
Mhm.
And that kind of, and so I kept dropping the cards, and I was frustrated, and it was noisy, and I was overwhelmed, and just it was too much. And I finally I set the cards down, and I was just like, look, I can't play this with you guys, and I'm not contributing to the fun here, so I'm gonna go lie down. And anybody else, I feel like, especially at Christmas time, would be like, okay. But my mother was like, why are you gonna go late? And I was like, look, I'm like, my brain is broken right now. Like I'm not thinking right. Like I don't, it's too much. And both my mother and my sister, who is 10 years younger than me, literally raised their voices to me, to shout at me and say, you're not broken. You're not broken. You're gonna get better. And I remember being like, again, what if I don't? How do you know? I don't even know. How do you know? And that's sort of that was then more emotional, and sort of like, I think if I'd had space, I would have been able to learn the game, and we would have been fine. But look, like, games are supposed to be fun.
Right.
If I'm not having fun, maybe don't play, and don't force me to. And I've really leaned very heavily into, there's a Japanese art form called kintsugi.
Yeah.
Which you can't see. It's called, I'm in Salem, Massachusetts. And it's really, really cold here right now, but I collect tattoos now, and one of them is a human heart, an anatomical heart with kintsugi lines. So what kintsugi is, for people who aren't familiar, is if they drop like something porcelain or ceramic, they don't sweep it up and throw it out. They collect the pieces, and then they mix gold leaf into the glue, so that when you glue it back together, you always see those lines, and they find beauty in the broken pieces.
Yeah.
And I've really embraced that, yeah, I'm different. Like, I don't think I could testify in court, for instance. Being cross-examined is really, really difficult, and you have to remember 47 things at the same time, but also remain very calm, especially being a woman in a men's system. And so I don't know that I could go back and do that anyway, but I'm a much better mother because I understand what it feels like to be frustrated and pressed beyond what you can express anymore. And I've learned to give myself the same kind of grace that I try to give my kids, of, okay, all right, we can't do this right now. And that there's a beauty in that. There's a beauty in saying, I may not be able to do this today. Okay. Like, there's not a whole lot of things in life that are really honestly live or die. So it simplifies a lot of things, and it gives me space to enjoy the things that I can do.
Yeah. It's those priorities and knowing what's important. The way that you have conversations on your podcast where you are able to listen and guide it and find those important and critical gems and have interesting conversations that are impactful for people. Is that something that you discovered as a talent when you started podcasting, or was that something that you were always good at?
A little of both. A little of both. I mean, not so. I mean, with forensic psychology has to be very structured for legal reasons.
Yeah.
Right. But crisis assessment, which is what I did the last 5 or 6 years that I was working, is less structured. It's still structured. There's still paperwork because it's a state job, and so there's always paperwork. But it's less specific and structured, and you're less likely to be cross-examined
Mhm.
on it. And as well, you asked earlier about, you know, I would see people in some of the darkest moments of their lives. And I learned while I was still working to embrace that as a gift. I would often drive home with no music on at all, no sound on, nothing, and just think about, like, who gets to see this? Like, everybody thinks they know what it's like inside a prison or what it looks like to be in the room with somebody who's suicidal or whatever, but I actually do it. And these people trust me. They trust me they're telling their stories to me. They're telling me things that they're not telling their partners or anybody else. And I have to honor that, and what a gift and what an honor that is to have. And when you're talking to somebody who's in, like, an intense manic episode or a psychotic break, you got to check your own reality at the door.
Mm.
You can't walk in going, okay, tell me what's wrong. Because they're just going to greet you with a couple of middle fingers and bad words. Like, that's all that's going to happen. So you have to learn how to check your own reality at the door and walk in. And the question that I would start with the easy stuff. Can you spell your first and last name for me? That kind of thing, even though I already knew it.
Mhm.
But it just kind of helps break the ice a little bit. But then the first question of any weight that I would ask is, what brings you here today?
Mm.
And that right there, how you answered that question told me a lot about how the next hour was going to go. Because I had people who would answer, I'd say, what brings you here today? And they would say, an ambulance. Like, oh, I was getting you one of those. Okay. Okay. All right. Lots of questions for this one. Cool. And other people, I'd say, what brings you here today? And they'd be like, well, when I was in second grade, and I'd be like, sir, you're 74 years old.
Mhm.
But that's, again, those are the ones where you just kind of sit back and you let them talk for a little while or whatever. And so it's learning who the person is and learning how to get them to tell you things. And like I said, as a forensic psychologist, but also as a crisis clinician, there's a question I have to answer. What is their diagnosis, or are they safe? Can they go home tonight? Those sorts of things. Well, it's different for every person. Somewhere in this conversation, I will get to that answer.
Mhm.
And it'll go better, faster, smoother, and less painful for all of us if we don't pretend. And not all of my colleagues agreed with me on this, because I had colleagues who would walk in and be like, sit down, I'm going to lead this. They're like, all right, that's how you want to do. But for me, I just felt like they're already stressed out enough. Let me let them tell me without telling me
Mhm.
how they communicate and how they roll, and we'll go from there. And so when I started the podcast, all of the shows I listened to until then were fairly either scripted or heavily edited, at least. And so I kind of thought that's how they had to be, and so my earliest episodes are several are fully scripted. And then I was like, wait, this is way too much work. Like, this is not fun. I don't want to do this. And even after that, they were planned very heavily for a while. And then I had the opportunity to do a recording with an ER nurse. And it was literally a matter of, I was DMing back and forth on Twitter with her. And I was like, wouldn't it be a cool collaboration? Because when people see a crisis clinician in the ER, they have to wait like 4 hours before they can see me.
Mm.
So she could talk about what happens in those 4 hours and why it takes 4 hours. And then I can talk about what happens after I walk in the room. How cool would that be? And I mean, your mileage may vary on coolness, right? But that's when I realized, like, I can just do this. I can just talk. And that was fun. I left that recording jazzed up, and that was fun.
Mhm.
That was an adventure. I want to do more of that. And pretty quickly after that, I stopped scripting. And once in a great while, I'll have somebody who really wants to set a topic to come on the show. And if that's the case, okay, fine.
Mhm.
It's not a requirement. You know, nobody's life has to be an open book to me.
Mhm.
But I use that skill of figuring the person out a little bit in how we talk, in the housekeeping that we do before I hit record. And then as it goes, and I've learned questions to ask, and I've learned questions to steer away from. And, you know, and I've learned when to say, like, this isn't working. I've only thrown out maybe 3 or 4 episodes total, but part of that is because I've learned how to say, look, something's not working. Can we reschedule?
That's a real talent, listening and really giving people that space to talk. You know, it doesn't seem like it should be so hard, but it is. Like, so many times we don't get that. So being able to do that is really, really amazing. When you do your podcast, is there a question that you're trying to get people to answer while they're talking, or is it we're just trying to figure out who the person is?
I don't have questions I want to ask, but I hate asking when I have authors on
Mhm.
fairly often. And I don't ever want to ask them, so what made you want to write?
Ah.
Because it just feels like such an insipid question. And if they're doing the press tour for their work already, it's out there somewhere, or
Right.
they'll just tell me. Like, if I have to ask them, then we're not off to a great start. And so I've only done it once. I've done it once in 447 episodes. And in retrospect, I know that what that was I didn't know, and she didn't tell me, that I was her first ever interview for her first ever book.
Wow.
So she was incredibly nervous.
Yeah.
And if I had known that or picked up on it more, then I would have taken longer with the housekeeping. And I've added some into my housekeeping, kind of describing my show for people who aren't familiar, and just sort of easing them in
Mhm.
a little bit. So there are certain questions like that. Like, I don't want to ask an easy question. Some of my biggest challenges are when I have people come on the show who are like well-known actors, for instance. I've had a couple who get in PR mode.
Yeah.
And now my job is to break them out of that,
Mhm.
because I don't care about you trying to fit in the maximum number of words in the minimum amount of time to sell your stuff. I want to get you to tell me a compelling story that makes people want to go buy your stuff. So that can be a challenge. Like, I've had a couple of people where I'm like, you just let it.
Mhm.
It's okay. You'll have time to say all the words you want to say. It's okay.
Mhm. Yeah. And you don't want to be asking the questions that they probably have to answer, like in every single interview. I'm so happy that you agreed to be on my show today, and thank you so much. Where can we find out more about your work, like your podcast? Where can people listen to that, for example?
It should be on all of the major podcatchers. My website is IWB, like ignorance was bliss, IWBpodcast.com. And I'm on most of the social media sites to some degree or other. I know right now there's some chaos happening in social media worlds, so I am still on Twitter. I'm also on Post and Mastodon. I am on Facebook and Instagram. So just sort of find me, iwbpodcast@gmail.com, wherever. I'm around.
Right. Super. I'll drop your web link in the show notes so they can find it there too.
Okay.
Cool. Thank you, Kate. It was great talking with you. And thank you so much for sharing so much about your experiences on my podcast. It was great talking today.
It was great. Thank you so much.